Our cameras were allowed into the country's biggest referral hospital, Port Moresby General Hospital. This is the emergency department. We see firsthand the response to general health matters as well as COVID-19 during the health crisis. While dealing with the day-to-day needs of the sick that turn up each day, the staff remain vulnerable also to COVID-19. As first responders to health needs, the number of health workers attending to the sick continues to drop as staff fall ill to the disease.
COVID is real. COVID is real, and you see, we are exhausted. Staff are exhausted, looking after more than 10 patients in here. So in here, one nurse is looking after 6 patients. It's too much. Yeah, but this is real. We are working. We have to help. As a nurse, we promise to save the patient. We are here to save the patient. So we have 6 staff who have been tested positive. And they are quarantined. They are away from the roster, leading to most with less staff on duty.
The man in charge of the ward, Dr. Yockopua, says COVID-19 supplies such as oxygen tanks are of greater need as a patient can use about a cylinder of oxygen within 2 to 3 hours. Added to the already burdened health situation is shortage of beds in the emergency ward. We are told it's the same story at other COVID facilities around the capital city.
Here we've got 10 beds, all the 10 beds are full. We've moved some of the patients to the isolation ward on the other side. It's full, the 16 beds are full. We've moved some to Ritterflin. The Ritterflin is about 80% full at the moment.
Dr. Yockopua insists on having patients with severe symptoms of COVID-19 in the hospital facilities because they have a higher chance of recovery than isolation at home. They say it's likely that if this situation continues, they will be calling for voluntary help.
That's one of the dangers of home isolation, so that we are very, very scared of. That's why we called in the AUSMET, the Australian government, and we're building field hospitals. So that these sort of people, instead of doing home isolation, and when they're complaining of short wind, we quickly get them in and we keep them, and so we observe them. Otherwise, they'll be dying in their beds, sleeping at home.
About 90% of the staff at the emergency department have agreed to get the COVID-19 vaccine as the government plans to vaccinate frontline workers as priority.
Our National Department of Health, it is advisable that we get our vaccine. So yes, there is true, there's a division. However, we'll advise for vaccination.
Gertrude Gabi, National EMTV News.